Pregnancy is an incredible journey, but it can also be filled with questions and anxieties, especially for first time parents. What's normal? What symptoms should be addressed? And how do you know what questions to even ask? Welcome to A Healthy Dose. I'm Julie Stautland, and today I'm joined by Justine Schilstra, a registered midwife with a Bachelor of Science in Midwifery from McMaster University. She has attended over 350 births, and we're thrilled to have her guide us through this important conversation. What to expect when you're expecting. Thanks for coming and talking about this.
Yeah, I'm pleased to be back. Thank you so much.
So, to talk at the beginning, let's back up. You find out you're pregnant, your head's swimming, and you've got so many questions. You're just like, where in the world do I start? What should I be thinking about, from doctor's appointments to nutrition to exercise to all of it? Where should they start?
I would say ideally, even if you can start before you conceive. So if anybody's listening and they're thinking about having a baby, that's a great place to start because prenatal vitamins with folic acid, that's recommended even 2 to 3 months before you conceive a baby.
And I don't think a lot of people think about that. It's like, really, your starting point, you should have a really good homeostasis starting point if you wanted to create life.
Yes, absolutely. And even like iron stores ahead of time, if you're thinking about being pregnant, seeing what is your CBC, your complete blood count, safe for you. Now, if you've already found out and you weren't taking prenatal vitamins ahead of time, that's okay, start now. But that would be a first spot to start.
So what about nutritional choices? You know that fast food diet or something is not going to be really great for feeding you and the baby, right?
Yeah, definitely just overall health and wellness, making healthy choices as much as we can. Everything in moderation is usually a good idea when you're pregnant. We have foods, of course, that we want to stay away from.
And what are some of those foods?
Yeah, so some like higher mercury counts in different seafood.
Okay.
You want to be mindful of like deli meats, anything that could be unpasteurized. Those are things that you would want to stay away from. So raw meats for sure.
I was going to say, you always hear like, be careful of sushi and things like that.
Right, yeah. So those just have a higher chance of possibility of different bacteria in them. And especially earlier on, if a woman gets that into her system, it has been linked to miscarriage. So in the first trimester, you want to be careful of that for sure.
Now, when a woman's pregnant, is it easier to get food poisoning?
Not necessarily.
Or is it just because you're trying to prevent it because of the fact there is a slight risk of...
Yeah, it's more the sequelae that would be coming with that. Like if a non-pregnant person got food poisoning, they're going to be unwell and they're going to get through it. A pregnant person might be unwell and really affect her pregnancy.
Absolutely. Now, what can moms to be expect at their first medical appointment? Like blood work, ultrasound? Like, what are the things?
Yeah, so in the first trimester, we would recommend to everyone a dating ultrasound at some time between 7 and 12 weeks.
Okay.
They would also be offered genetic screening. So a first trimester screen, which would be blood work and ultrasound, to check on a few different abnormalities that can be detected in a newborn, in a baby inside. We also recommend blood work at the beginning just to check on a few different parameters, and then a urine sample as well. Yeah.
Now, how about the care team, whether they go for an OBGYN or a midwife, or when should they start considering that?
Right. So ideally, you start considering that early on in pregnancy. That way you can maybe meet your care provider in the first couple weeks. So I know most people will see you between 10 and 14 weeks for a first appointment.
Okay.
So you make that decision early on, ideally.
Okay. Now, what about spotting? Like, especially first time spotting or some bleeding in early pregnancy. Is this something to be concerned about? Is it normal?
Yeah.
When should you contact somebody about it?
Yeah, good question. About 25% of women will experience some spotting in the beginning of pregnancy. And the question is it a normal thing that's going to resolve, or is it the beginnings of a miscarriage?
Right.
And so when we counsel people through that, we see, are you having cramping associated with that as well? What's the level of bleeding? So a minimal amount of spotting, and minimal might be like when you wipe, for example, after going to the bathroom. If there's a little bit of light blood on the toilet paper, that's a small amount. But anything more than that, typically something might be going on.
Okay. Well, stay with us. When we come back, we'll talk about the many physical changes that you experience with pregnancy.